Hi, I am Amit Lunkad. In this video, we discuss about the thyroid and anti-thyroid drugs. This video contains introduction, then biosynthesis of thyroid hormone, the different diseases involved in like hyperthyroidism, and treatment in this condition. The drugs in detail which are used in this hypothyroidism and hyperthyroidism. Let's begin with the introduction. All vertebrates have thyroid glands. It is not essential for life, but it is necessary for growth and mental well-being. In a healthy adult, it weighs about 25 grams and is composed of two lobes which lie one on each side of larynx. So here is the diagram. This is the orange color, this is the left lobe and here is the right lobe. So which are present on either side of the larynx. It is larger in women than in men. Thyroxine, that is T4, and triiodothyronine, that is T3, are the principal thyroid hormones. Chemically, they are amino acids containing iodinated diphenyl ethers. Triiodothyronine is more active than thyroxine. The T3 and T4 hormones, which play an important role, why they are necessary, here we discuss. So these T3 and T4 hormones are necessary for oxygen consumption, heat production and metabolism of carbohydrates, fats and proteins. They require for proper functioning of the gastrointestinal, cardiovascular, reproductive, skeletal and neuromuscular systems. They having an optimal functioning of catecholamines, antidiuretic hormone and glucocorticoids and which are required for normal growth and differentiation. So here we discuss about biosynthesis of thyroid hormone. The biosynthesis of thyroid hormones is regulated by variations in the plasma level of thyroid stimulating hormone, that is TSH, from the anterior pituitary gland. The conversion of inorganic iodine to thyroid hormone involves following steps: iodine uptake by the gland, oxidation of iodine and iodination of thyroxyl groups, formation of thyroxine and triiodothyronine from iodotyrosines and release of thyroxine and triiodothyronine. In detail, the biosynthesis of thyroid hormone takes place in follicular cells of thyroid gland. The whole process involves an intact and coordinately controlled synthesis pathway containing sodium iodide symporter, hydroperoxidase, thyroglobulin, and adequate dietary iodide. The production of thyroid hormone is initiated by the absorption of iodine from the GI tract, where the iodine is reduced to iodide and released into the plasma. Follicular epithelial cells take up iodide ions from the blood through sodium iodide symporter. Iodine uptake is an active transport against inverse electrochemical gradient because the iodide level in the thyroid gland are much higher than that in the plasma. Iodine is transported at the apical membrane into the follicular lumen by pendrin. The oxidation of iodide by hydroperoxidase forms active iodine. The active iodine binds to the tyrosine residue of the thyroglobulin under the action of an iodinase, forming two iodothyroses, monoiodotyrosine and diiodotyrosine. The iodothyroses undergo subsequent coupling reaction by thyroperoxidase to generate T4 and T3. both of which are stored as colloids in the thyroid gland. T3 and T4 are transported through the bloodstream on thyroxine binding globulin and thyroxine binding prealbumin. So this is the biosynthesis of the thyroid hormone. Here is the structurally represent the biosynthesis of thyroid hormone. So this tyrosine converts into monoiodotyrosine. Further it will convert to 3,5-iodotyrosine. Then thyroxine, that is T4, and it will convert into 3,5-3-triiodothyroxine, that is T3. Next here we discuss disease of thyroid gland. So mainly it will form a hypothyroidism and hyperthyroidism. The hypothyroidism further classified as simple goiter, maxedema and cretinism. So here we discuss in detail about these conditions. The most common cause of hypothyroidism is because of iodine deficiency, and it will cause a simple goiter. In this, normal secretion by the thyroid requires an adequate intake of iodine. If it does not meet the requirement, thyrotropin is released in higher concentration, and which results in enlargement of thyroid gland. And this enlargement of thyroid gland is known as goiter. Next is the maxedema. Thyroid hormone deficiency may result due to spontaneous degradation of granular tissues, biosynthetic defects, or impaired secretion of the hormones which are hormones synthesized. Maxedema is a case of severe hypothyroidism which causes the infiltration of the intracellular spaces of skin and muscles with mucopolysaccharide. Hypothyroidism, the most third one is the cretinism, which is a case of severe hypothyroidism in infant associated with a goiter. It involves similar symptoms to that of maxedema and results in neurological, sexual, mental and physical retardation. The basal metabolic rate is depressed. It is usually occurred in infants having congenital defects in thyroid development. So here is the drug which can be used in hypothyroidism, namely levothyroxine, levothyronine, and structure of these two. Next one is the hyperthyroidism. Graves' disease is a toxic diffuse goiter which is called hyperthyroidism. It is characterized by increased iodine uptake. It is an autoimmune disease. Stimulation of TSH, that is thyroid stimulating hormone. So treatment in hyperthyroidism involves use of anti-thyroid drugs. The choice of treatment will depend on type, severity and individual characteristics of the patient. Anti-thyroid drugs include thioureline, drugs like carbimazole, methimazole, propylthiouracil, inorganic compounds like lithium salts and radioactive iodines. Here we discuss in detail about all this class. First about radioactive iodine. The radioactive isotope causes selective depression of thyroid activity by emitting beta rays which effectively destroy some of the secretory part of the gland. Since thyroid gland absorbs most of the iodine supplied to the body, other organs remain unaffected. Sodium iodide is a safe and effective compound which impairs thyroid function by radiation damage. Next is the use of anti-thyroid drugs. These drugs act by inhibition of the synthesis of thyroid hormone. They exert immediate effect as they act at the first stage of iodine incorporation by the gland, and they classified as thioamides. Example: propylthiouracil, carbimazole, methimazole. Aniline derivatives, example like carbutamide, PAS, sulfanilamide. Polyhydric phenols, example resorcinol. Ionic inhibitors, example potassium perchlorate, thiocyanate. And miscellaneous agents, example lithium carbonate, adrenergic blockers. Now, next is about the individual class here we discuss. First is thioamides. The methyl and propylthiouracil are effective drugs under this class. They prevent iodine incorporation into the organic form, perhaps by antagonizing the iodine oxidation by peroxidase enzyme. They are also found to prevent coupling of iodotyrosine to form iodothyronine. They do not influence the breakdown or release of thyroid hormones. Skin rashes and agranulocytosis are the most common side effects of these drugs. So here is the structure of these drugs like propylthiouracil, methimazole and carbimazole. So you have to remember it is the derivative of thiourea. This NH, C double bond S and NH. So this is the thiourea part, and here is the remaining part which is having a date form a ring. Methimidazole. So here is the structure having a SH group in the second position, and carbimazole. These are the effective drugs used in hyperthyroidism. Then aniline derivatives. These agents interfere with some of the processes catalyzed by thyroid peroxidase like iodine oxidation, organification and coupling of iodothyrosis. Examples: carbutamide, which is an oral hypoglycemic agent, and sulfanilamide, para-aminosalicylic acid. So these all the drugs here we use as an aniline derivative, which are also having a different therapeutic uses also, like para-aminosalicylic acid, which can be also used as an anti-tubercular agent. Sulfonamides, which can be also effectively used in urinary tract infections, and this carbutamide, which is an example of a oral hypoglycemic agent. Next one is the polyhydric phenols, which are having a same mechanism of action to that of thioamide. So example is resorcinol. Then ionic inhibitors. These anions resemble iodine ions and affect the power of thyroid gland to accumulate iodine. Examples are potassium perchlorate and thiocyanate. They are inhibitors of the iodine transporter into the thyroid gland. And some miscellaneous agents like lithium carbonate. The lithium appears to prevent the release of both hormonal and non-hormonal iodine from the thyroid gland. It is less preferred agent because of its adverse effects include tremor with high risk of cardiac failure. Adrenergic blockers. The hyperthyroidism has some of the symptoms common with overstimulation. Because of this, the adrenergic blockers are sometimes used in alleviating many signs and symptoms of hyperthyroidism. Examples of adrenergic blockers are reserpine, guanethidine and propranolol. So here we discuss in detail about the thyroid and anti-thyroid hormones. Hope all of you getting this. Thank you. Happy learning.